the autonomic nervous system, alongside visual agnosia, prosopagnosia, and damage to the prefrontal cortex. The autonomic nervous system and its functions. The main basic principle for the autonomic nervous system is that it regulates a large variety of processes that do not require conscious thought or intervention. It is part of the peripheral nervous system, which is responsible for involuntary functions within the body such as blood flow, digestion, breathing, and heartbeat. Walter Gaskell, 1847, was pivotal in mapping out the autonomic nervous system. His work was published in 1916, which was in fact 2 years after his death. The image on the left is of Walter Gaskell. He could be seen as very important regarding the physiology of the ANS. The sympathetic nervous system. The SNS is a subdivision of the autonomic nervous system. It is involved with regulated unconscious and autonomic processes such as preparing the body for any activities related with stress. This involves processes such as dilation of pupils, secretion of sweat glands, vasodilation of skeletal muscles, increased alertness, relaxation of the bladder, slowing down digestion, increased heart rate, alertness, as well as releasing epinephrine from the adrenal gland, and an increase in cardiac output. This is known as the fight or flight system, the human body's response when presented with a threat. Anatomical landmarks of the sympathetic nervous system. So, Petit in 1724 demonstrated that when cervical sympathetic nerves were stimulated, the pupils would dilate. Winslow in 1732 discovered that the sympathetic nerves did not arise from the cranial nerves. And Haller in 1757 to 1766 was the first to discover the rami communicants, which are nerve fibers that connect the ganglia in the sympathetic chain to spinal nerves that consist of grey and white matter rami. Just on the right here is the first ever diagram of the sympathetic nervous system. The fight or flight response is an evolutionary response. The fight or flight response is a reaction to an event or situation that is perceived as frightening or stressful. This threat perception is responsible for activating the sympathetic nervous system, triggering a response from the body in preparation to fight or flee. These are evolutionary adaptations that increase odds of survival in threatening situations. On the left is an image of a situation that could have possibly triggered earlier human ancestors, or even humans of today for that matter. Parasympathetic nervous system, which is after fight or flight. This is another subdivision of the autonomic nervous system, also regulates involuntary functions. This is also known as the rest and digest system, responsible for relaxation of the individual once a threatening situation has passed, a state of decreased arousal, or otherwise known as homeostasis. The functions of this include decreasing the heart rate, constricting the bronchi, which results in slower breathing, constriction of the pupils as they are no longer needed to let more light in. Lacrimation occurs also to lubricate the eyes to preserve delicate tissue, and it also stimulates salivation to assist in digestion, hence the term rest and digest. And this process will happen once the tiger from the previous slide is gone, or you've run away from it, or the threat itself is just gone. So, visual agnosia, history, examples, and symptoms. The term agnosia is regarding an individual's difficulty to recognize real objects, scenes, actions, spatial relations, and issues understanding language, whether it is oral or written. The term agnosia has various modalities, being somatic, visual, tactile, or auditory. Freud in 1891 was first to coin this term. The first term before this, however, though, regarding recognition and the use of learned symbols, was coined by Finkelnberg in 1870 as asymbolia. In 1883, Charcot outlined a case of a well-educated individual who was fluent in different languages, including Greek and Latin. After suffering a stroke, the patient could not recognize objects that were previously known to him, such as his own face and the face of his wife and children. He no longer had any memory of shapes and colours or letters of the alphabet. Visual images in his dreams were destroyed, and he had difficulty navigating the town in which he lived. These symptoms and changes in behaviour were later described as different types of visual agnosia. This is based on the difficulty of different tasks. These were outlined as visual object agnosia, prosopagnosia, visual spatial agnosia, loss of visual images, and primary alexia. Visual agnosia is when an individual has a disorder regarding visual recognition despite fully functioning sensory organs. Diagnosis from this arises through assessment of an individual's ability to name, describe, and describe the uses of an object. The two forms are considered aperceptive, which is impaired visual processing, which ends in poor perception of an object. Associative is where there is an impairment regarding assigning meaning to an object or visual stimulus. This associative form is caused by issues regarding the associative cortex. Most patients present issues with both of these, but it is typical one is more predominant than the other. Damage to the occipital lobe is considered common regarding the cause of this issue as well, namely being anoxic insult or severe infarction of the occipital lobe. And just on the right hand side of the screen, the top image shows where the associative cortex can be found, and below that is where the occipital lobe can be found. Prosopagnosia. Prosopagnosia, as we've previously mentioned, not the function, or not what it is, but we've previously mentioned the words, is also known as face blindness, a disorder in which individuals cannot recognize faces. An individual with prosopagnosia may be able to see individual parts of the face, such as the eyes and the mouth, but stringing the whole puzzle together, the picture as a whole is an issue. This also regards the face of the individual themselves. It may cause great social difficulties and issues with building emotional connections for sufferers, as deciphering individuals apart can be challenging. This disorder is at times inherited, which is known as developmental prosopagnosia, but also caused by brain injury, which is known as acquired prosopagnosia. So, damage to the prefrontal cortex. Individuals with damage to the prefrontal cortex have been known to experience changes in personality. The cortex is located at the front of the brain, directly behind the eyes and forehead. It can be divided into the subregions such as dorsolateral cortex, ventromedial cortex, and the orbital frontal cortex. These areas are responsible for functions surrounding abstract reasoning, goal-orientated behavior, decision-making, and the parts of an individual's personality traits such as expression and creativity are also localized here and known as executive functions. These are associated with higher cognitive processes, helping with understanding of long-term consequences for actions. Damage to this area of the brain may manifest itself in changes in behavior surrounding such traits. Somebody who has suffered trauma to this area of the brain may also have changes in executive functions such as self-monitoring, self-correction, and initiation. Damage to this area is often different to the classical signs of brain injury such as movement and general intelligence. Family members of individuals who have suffered trauma to this area have reported notable personality changes such as blunted emotional responses, increased aggression, and become irritable more quickly, as well as performing poorly on tasks which involve impulse inhibition and long-term planning. Other noteworthy effects of this may be decreased empathy, short-term memory loss or amnesia, stubbornness, and perseveration. Thank you for listening.